Here we go. Hey, Eastern Oregon Alive. Thank you for joining us today for our COVID update. And today I'm joined by Elizabeth and Carrie. We've gotten to know each other pretty well on this platform over the last few weeks. And we missed last week, and we were supposed to be yesterday. That's when we were supposed to be having it. And because of my schedule, we were not able to. So thanks for being able to accommodate this. And thanks, ladies, for being with us today. Anything new, exciting going on in your lives?
Not really. Still just a lot of COVID.
Yeah. So Elizabeth, you are at work, though. That's kind of changed.
I am. Yeah. So I have started integrating the work back into being in the office. So welcome to my new Facebook Live area. It became pretty clear as we moved into phase one and we had to increase our staffing capabilities here for case investigations and contact tracing that the communication was really hard to do remotely. So I'm, trying to integrate back into the office, still maintaining distance and trying to do it as safely as possible so that I don't take it home to my family. But it does offer us the ability to be able to serve our clients a little bit better with communication when we're investigating cases and whatnot.
Excellent. And Carrie, how about you? Anything going on in your life?
Well, a little bit of COVID. It definitely continues to be our primary focus and a lot of work. And I think you can still see that I have my normal Facebook background and I am in my position able to work from home. And I think that as we move through phases one and hopefully soon into phase two, I think there's still going to be some requests for us to continue working at home if we're able to do that. Because if we can do that, that's definitely one way we can contribute to reducing the spread and reducing the interactions between people. We really still believe, as we continue to learn more about this disease, that it's that close contact that is really how people are most likely to get it. And so again, I think that it will make sense for some of us to start moving back into our work environments in ways that we haven't been over the last few months. And I still think that there'll be folks like me are able to continue doing some work from home, that will definitely be a way we can continue to contribute to keeping the spread low like we've all been doing so far.
Great. And Carrie, why don't we start there? Talk to us about the difference between phase one and phase two, and what's the next marker for us all to get to the next place?
Well, I'll be honest with you. I think that we don't entirely know the answer to that question right now. It's very clear to me that there are various groups and entities working on guidance that will be given to us to help support what phase two looks like, but we haven't necessarily gotten those documents yet. They're still a work in progress. And of course, this whole thing has been, we're doing a lot of work in a very short periods of time. And as I'm sure everybody who's watching knows, we're potentially able to move into phase two next week. So my expectation is over the next week that we'll be getting more information out of the governor's office, the Oregon Health Authority, and the various entities that are supplying the guidance. What I will say is that the indications I've gotten from the calls that I've participated in and the things that I've heard is that the existing guidance is probably not going to change significantly. The guidance, for example, for restaurants or retail, employers, the public, all of those guidance documents that you can currently see on the Oregon Health Authority's website and the governor's website. There may be some small changes, but it sounds like generally those will remain fairly consistent. As we move into the next phase, there will probably be additional sectors that have specific guidance. I know they were specifically talking about youth activities. I know there's lots of questions about facilities like swimming pools. And again, I have no indication at this point what that will look like. But I do expect that we'll hear more in the next few weeks. And then, of course, I think the expectation is in a phase two, you would be able to allow larger gatherings. So that is definitely something I would expect the gathering size to increase. And we haven't heard a final number yet, but it will definitely be a higher number than it is now. So again, over the next week, hopefully we'll get more information.
Good. And what is your experience? I mean, how have businesses and people locally been adapting to phase one? What's your experience there? And what are you hearing?
You know, honestly, I haven't heard a lot, which I think from my perspective, is probably a good thing. And again, there are different folks that are working at CHD that are interacting with those entities that may have more direct experience. But, you know, usually when I'm hearing about it, it's because there's a challenge or an issue or something that they need additional support on from me. And so I haven't actually been getting a lot of input and feedback. You know, I'm certainly tracking our disease rates. And so far at this point in time, it seems like as we've entered into phase one, we haven't had any significant outbreaks or significant increases in the level of disease. And we're focusing on making sure that we can meet the measures that would keep us in phase one and allow us to move into phase two. And so based on the data that I'm seeing and the indications that I have right now, it seems like things are going okay. Now, you know, we get little bits of feedback here and there about differences people would like to see. And so we're obviously carrying those forward to the folks that we can share that with that are giving input into the decisions. But personally, I haven't heard anything. And I don't know if Elizabeth has, but that's been my experience so far.
So a little bit of clarification, Carrie, for me. So and I know that you worked with the county to apply to be reopened to phase one. But when it came right down to, I was a little confused by the governor's thing. It seemed like you all had gone to a lot of work to jump through the hoop. And then at the last minute, she just kind of opened the floodgate to everyone. Was there a correlation between you applying and her approving the thing? Or can you clarify that just a little bit? Because I was a little confused about how that all went down. Not that it really matters. I'm just curious.
Yeah, no, I think that, you know, our county, the county emergency manager, the various entities that have been critical in the response, like law enforcement, EMS, Grand Run Hospital, the Center for Human Development, local education, LaGrande School District, all of those entities definitely contributed to and supported the development of the plan that was submitted to the governor. And all of the counties that were approved on that one day did submit plans to the governor. Those plans were reviewed by the Oregon Health Authority to make sure that they met the benchmarks, and then they were routed back to the governor, who gave the final approval. So, you know, there definitely was a process. Those plans definitely were reviewed. We know they were reviewed because we were asked for clarification on a few of the items. So my understanding is that all of the counties, except for a few that didn't end up applying on that initial deadline day, which was, a few weeks ago, did apply. They did submit the plans, they were reviewed, and they were approved, as you saw, all on the same day. So
good. Well, and thank you. I know you guys, I can imagine you worked really hard to make that all happen. So, well, let's talk about masks. You guys have a Facebook campaign going on about that. Give me the pitch. Tell me why this is important. Elizabeth, do you want to jump on this?
Sure.
Okay.
Yes. So we have launched a campaign on Facebook as really a main platform to kind of help spread the word with the intent to really make mask wearing in public normal. A lot of people are still maybe struggling to comfortable wearing a mask. We want to educate and encourage people to wear a mask again, like we have been saying from the beginning, not only for your protection, but really for the protection of everybody else. And, making it, it's something that we're not used to as a society. And so making it normal, making it so that people are not feeling maybe some reverse judgment. There's some fear that if I wear a mask into a grocery store, people are going to look at me as if I'm infected. And so really just comfortable for everybody. And so there's actually a profile picture frame that our PIO George, who is always behind the scenes and doesn't get enough credit for the work that he does, created. He actually created this for us. So it's specific to CHD, and you can add it to your profile picture, and it just says, why I wear a mask, because everybody's reason for wearing a mask is different, and we want to honor that. Some of us are really worried about our grandparents. Some of us are worried about our own children. Some of us, might live alone and not have families that we need to protect, but we're really conscious of the grocery store workers that we want to help protect. So we want to encourage everybody to hop onto Facebook and not change their profile picture, but to add that picture frame around their profile, and just encourage all of Union County residents to really just make it normal.
So what do you think? Yeah. So what do you think? Since it's camo, I'm wondering, can you even see my face at all? And on the more mysterious days, like if I'm cloudy, if I have a cloudy mood, then I wear the black side. And actually, I haven't been very compliant, but I do have it, And I guess I would say that I don't. For those people that might feel judged for wearing one, I don't know. There's nothing in me. I mean, I'm clearly I can't speak for everyone, but I think we're in a place where we just have to not judge folks for doing the thing that they do that makes them feel comfortable, whether that's not shake hands or, not be close to each other or to wear a mask or, so, so I don't, how are people responding to this specifically in Union County? What are you hearing from folks?
Well, unfortunately, a lot of the feedback that we get is not direct to us. It's more of us. And again, our PIO really monitoring our atmosphere on a social media basis. So I think that there is still a lot of resistance in Union County, unfortunately. Again, I think it's just unfamiliar. It's something that we're not used to needing to do. And so we're really hoping and putting a lot of effort into decreasing the fear. I think a lot of people, most of the time, judgment comes out of fear with human behavior. And so what can we do to really change this on a human behavior level?
Yep. And I follow that. So somebody texted me a question, which you hear quite a bit, and that is, and Elizabeth, this is like one of your places. So talk about breathing back in your own carbon dioxide. And I don't know, talk about that, because that is a real thing out there for folks.
It is a real thing. And and if you are wearing a mask like what you just had on, that is not necessarily as much of a concern as like wearing a fitted respirator mask that medical professionals need to wear sometimes. I think that the important thing for people to know is that you can take it on and off, but to do so safely. So, are you in the grocery store for hours and hours and hours at a time? Like, where we still want to encourage people to do social distancing. So I'm curious when I read those questions and concerns, where are you at in a scenario where it needs to be on for 10 hours at a time? We can always make accommodations, and it's really that, we have to get creative about it. Can you go to a place that's, safe to go to and take it off safely by the ear? Don't touch the outside and take it off, or, wear it on your head or wear it on. This is my favorite. I'm going to grab a mask real quick, actually. This is my favorite thing when I'm in the store. and I see people like this, that doesn't do you any good, right? That doesn't do anything. And when we wear it down here, what we're doing is we're taking the germs that are on the outside of this and we're exposing ourselves to it. So same as if, we wear it up here or whatever we do with it, we put it on our wrist and we wear it around. So, you can definitely allow yourself to have breaks. If you're feeling like you're not getting enough oxygen, if you're feeling anxious about it, start with small increments of time of wearing it, getting used to it. I promise your body has compensation mechanisms. Go somewhere where you're 6 feet from somebody. I'll demonstrate the proper way to take it off to prevent spreading infection and actually making it an increased risk for you. So you have it up around right here. And to take it off, you just take your finger and you loop it around like that. And then you have your mask like that. So, get yourself to a spot where you can do that and take it off, take a few minutes, and then reapply it.
Yeah.
That would be my recommendation.
Well, and again, the wisdom of this is if you're working out on the yard all by yourself and it's hot and you're sweaty, there really is no purpose of you wearing a mask. So it's, if you're by yourself, the mask is to insulate yourself from others, from what you might have and what they might have. And so,
it's an additional layer of protection on top of social distancing. We want to be really clear about that. It's in addition to, it's not in replace of social distancing.
Right. And also, it's not needed 24/7. It's needed when you are interacting with other folks, other people, or you're in an environment where there are a lot of people. Then that might be another time that you might consider it. So, yeah. And it's kind of funny because the little double standards side of me, if I go to a business, okay, or if I go to a professional organization, there is some reassurance for them to see that they are wearing mask. That reassures me. But the hypocritical side of me is as well, you're wearing them, so I don't need to. So, but that's, this is I pray to God this is not a normal, because this will be as much like seat belts as anything else. It took years and years for people to be compliant and to do that kind of thing. And I'll be really happy, and I know others will be when we get past this. So you have anything you want to throw in there, Carrie?
Yeah, I really appreciate that you brought this up. I think that it's a great reminder for us. We know that the masks that we're using that are not the respirators that Elizabeth mentioned are not going to provide you with 100% protection from this virus. So the intention is really that we need to keep physical distance from each other, because that is what we really believe is the most likelihood of the likely mechanism for this virus being transmitted, is you being in close contact with somebody that has it. And we believe that asymptomatic transmission is very likely. So again, close proximity is really what we need to be looking out for. And if people can maintain physical distance, then that's going to be the best protection. If you're in a place like a grocery store, you really do need to be in an environment where there are people that you are in close contact with. It's just another tool that you can use. And I think one of the things that I've been thinking a lot about this week is that, there are certain people that are very vulnerable to having a serious, severe outcome from COVID-19. And, we know that most of the population, they'll get it. They may have a mild illness. They may not have any symptoms at all. They might be, sick enough that they're down for a while, but they recover. But the people that are most at risk of having something really serious happen are people that are older and people that have chronic conditions. And so, again, I just think so much about how this is one thing that I can do to keep them safe. And, again, I don't have to wear the mask all the time. And I'll be honest with you, it makes me, I feel like it makes me have a harder time breathing. It causes me a little anxiety. I really get where people are coming from in, it being something that's not normal and not something that they're used to. But again, I feel like for me, if I'm going into the grocery store, it's a small sacrifice that I can make today to keep somebody who also needs to be there just as much as I do safe. And again, just my responsibility to my community. So I'm grateful when I see people wearing them. I understand that some people can't. And so I think, again, we just have to understand that we won't see some people wearing them, and they may have a really great reason for not doing that. It may not be appropriate for them to wear it. But for those of us that can, in the right environment where it's really needed, then that's definitely something we can do to help.
Yeah. Good. And so just to make a real practical point, let's say you're out walking your dog. It's just you and your dog. You might keep a mask in your pocket so that if you run into someone that you want to converse with, before you get too close to them, you could put the mask on and you could have the conversation with them. I mean, am I putting it close together?
Mm-hmm.
Good. All right. Well, hey, let's move on. So there are some things that are happening in testing that are changing. I do know that locally a couple of weeks ago, and I know this from the folks that I know at the hospital, that there is a new test. I don't know if it's new or not, but tests can be turned around in as little as an hour now, and that's good. On the same hand, it is so funny because it corresponded almost exactly to the day, or at least when I heard the news, with the reopening. Well, there could be that since the testing is more efficient, then just because of that, we might have an increase in cases because we're now aware of cases that we weren't before. But talk to us about testing, and are we looking at some changes coming about down the road here?
Yeah, so I want to make sure that we don't speak for the testing capabilities that GRH has. But I do think you're right. I do think that they are bringing on some additional testing capabilities that they're using for protection of their staff and being able to return to some of their businesses or their services that they were able to provide pre-COVID that they hadn't been able to for a while. I think you're referring to probably the saliva test that can be turned around in less than an hour. And, really your thought process about that is right. The more we test, the more we're going to find the disease. I think a really important thing for our community to remember and to think about is the efficacy of those tests. So there are times and places that a really fast turnaround rapid test, such as the saliva test, is appropriate because you need those results quickly. There are other times where because the efficacy of those saliva tests are considerably less accurate than the nasal pharyngeal, the swab that goes up the nose that we've really started with and people have associated COVID testing with, will be a lot more accurate. So the biggest news that we have here at CHD that I want to highlight and just kind of float out there, we're excited to announce that we are working really hard and getting really close to increasing our on-site capacity here to test at Public Health. And so we really just want to encourage everybody to be watching for news that we're going to be releasing about when and where that's going to be and how people can qualify for testing and our process of what that's going to look like. But we haven't really been able to, for many different reasons, been able to help expand the testing capacity in Union County up until this point. And so we're really excited to partner with our other healthcare entities in Union County and be able to increase the testing in Union County and help our community out that way.
That's excellent. And so explain what we have been doing So how have tests been happening in the past? And then how are you guys going to be effective in that process?
So the main places in Union County that people have been able to be tested at is the, through their PCP, whether that be at LeGrand Family Practice or Grand Ron Hospital Clinic, or at the hospital, the ER, really the providers, the doctors in the area, the clinicians, I should say. But going forward, because Oregon Health Authority has been able to secure some relationships with some private reference labs, now as a public health authority, we can send labs to, we can test people and send labs to places where we haven't been able to before. So this opens up a population of people that we are able to test that we haven't been able to before.
Okay, and what's the criteria going to be for people to, do you know yet what is the benchmark they're going to have to meet in order to be tested from public health?
So the same benchmark as anywhere else where you could get tested anywhere else. So we will be screening people ahead of time. It won't be a just anybody who wants tested sort of deal. There are still relationships with the labs that we have to meet, and they will only process if people meet criteria. So, but right now that's the loosest it's been in a long time. So anybody with a fever, a cough, or shortness of breath, or somebody who is experiencing two symptoms of a headache, a sore throat, fever and chills, muscle aches. So there are some, a lot of different scenarios where someone might qualify. And we're following the same testing guidance as what you're going to hear if you go to your PCP or you go to the ER. But what we're able to offer is just an ability to get test collected without seeing, a healthcare provider. If you feel like you are ill, but you're not ill enough to go to the doctor, but you want to be tested and you are eligible when we screen you, we can test you.
Excellent. So now somebody from Facebook said, so how many, and this kind of goes back to our previous question, so how many cases do we have in Union County? And the answer to that is we don't know. What they're saying is we know how many confirmed cases, which right now is how many? Six, yeah. But we've talked about this many times before. People with a mild case of COVID could have had the disease. They could have isolated themselves. They could have moved through it, and they could be back to fully functioning. And we might not ever know that they had COVID unless at some point there's some antibody test that we can find indicators that their body did build up antibodies to fight COVID. Is all of that true?
Correct. Yep. So increasing testing capabilities is really just to be able to help people identify if this is in fact what they have, and so that we can provide more structured education and isolation help resources to keep those people from situations where they might be in the community spreading it. I think everybody always wants to do the right thing. When you know that you have COVID, you're probably going to stay home. You want to do the right thing. You want to protect your neighbors. But if you don't know that you have it, then, you might mistakenly do something. So this really is, we will never truly know how many cases, how much the disease is upon us unless we were able to test every single person. But even then, you could come in contact with it 3 days later, and that test could be totally irrelevant. So
right, and tests do have a negative factor, a false positive,
a false positive, negative. Correct.
Yeah. Okay. Yeah. So talk about. So we're opening. People are excited about that. I think generally, Eastern Oregon people are resistant to being told what to do, regardless of whether that's wear a mask or not be in contact with each other. And I see that in the people. I see that resistance in them. but I just want to go over again something we went over a couple weeks ago, the contact tracing requirements, meaning that even in this environment, if somebody is tested positive for having COVID, Elizabeth explained to me the questions that they're going to face and what it is that they're going to need to do in order to isolate themselves for the next 14 days.
So you're asking what somebody who's been identified as a contact, not a case,
Correct.
a contact.
Well, let's start with a case. So they have COVID, yeah, and then kind of dribble it down from there. So people still understand that. So they understand the rationale behind the masks and behind the stuff, because we forget that. And I want you to help them understand how, if they get COVID, how their lives are going to be impacted in a negative way, not just from the disease, but so tell the procedures, talk to us about the procedures that happens.
Yeah, so when somebody is tested positive for COVID, they are classified as a confirmed case, and we initiate a case investigation with that individual. That really entails identifying when they were first symptomatic, and going through. We take 48 hours before those symptoms start, and we go through everything that they might have done and who they might have come in contact with from the beginning of that 48 hours before symptom onset all the way through to the point where they began isolation. So hopefully they began isolation because they were sick and they were just following general guidelines before they got the positive test result back. But let's say that they got tested for COVID, but they were really not that sick, and so they've been going to work anyways until we called them and said, hey, you've tested positive, you need to head home. So we would go 48 hours from before their symptom onset to that moment, and we would identify everybody that they've come in contact with. Did you go to any stores, restaurants, gas stations, work, daycare, who all is in your household? And we collect all of that information, all of those people's, as much as we possibly can. Now, we are really focusing on the people who they were around for at least 15 minutes and or shared any really significant services with. So obviously, household members are identified as contacts to that case right away. And anybody else that we identify in that case investigation that came in contact with that person for at least 15 minutes. Then we follow up with every single one of those people. So let's say we elicited a list of 10 people from that person that we just called and said, hey, you've got COVID. We call each one of those. We try our hardest through some, finding their contact information, finding a phone number, an email, an address, some way that we can get a hold of them, and we identify to them, you've been named as a contact to a positive COVID case, and this is what we're asking you to do. You are now being asked to isolate for 14 days, quarantine. I apologize. The wording can get tricky. We're asking you to quarantine for 14 days, which means finding a place either inside your home or some other place where you're not going to be around people. Now, for everybody, that looks a little bit different. They might decide to quarantine in their house and expose still the rest, live amongst their other household, or they might choose to go to a bedroom by themselves and stay in that bedroom for 14 days. But they are being asked to not be around anybody in the public for 14 days. No going to work, no grocery shopping, no going anywhere outside of your household unless it's, maybe to your backyard to get some fresh air if you can do so safely, and not be around or contaminate a whole bunch of doorknobs on the way. So for a lot of people, this is a significant barrier. For most of us, we're working. That's 14 days that we need to notify our employer that we are not going to be able to be at work. So somebody from public health, one of our contact tracers, is checking in with that person. They're taking their temperature twice a day. They're monitoring for symptoms, and we're checking in with them at least once a day and collecting all of that information. And then really what happens from there is really difficult to explain, because there's about 50 different scenarios that could happen in the course of that, and when they're released from quarantine, and when they might become a presumptive case, and all of these different definitions. But the gist of it is once you have been a contact to somebody, the implications for yourself and your household really snowball, and it's difficult.
So the message is if you are faced with that, maybe wearing a mask isn't that inconvenient after all, right? Because that's a lot of inconvenience. And again, just to explain, the tools have changed over the course of time. When we first started this, partly because we didn't know what was going on, partly out of fear, partly out of it was like, okay, let's just shut everything down. And so then everybody isolated, and we could talk about that. They will be talking about that particular thing for years and years to come. But the tool that we've moved towards is, okay, let's put these practices in place so that we're reducing the ability to spread it to each other. And rather than locking down the entire society, let's be more selective about locking down the people that we can confirm do have the disease, or who have been exposed to it, who might spread it and give it to someone else. Is that kind of a good summarization?
Yeah, I think that's a really accurate summarization. And I think that you mentioned, like, so should I wear a mask? Like, yeah, a mask is kind of uncomfortable. Gosh, it's a lot better than not being able to go to work for 14 days. I also think about, like Carrie mentioned when we, opened this segment up today, if you can still work from home, still work from home. If you can still do grocery pickup and avoid, any grocery store contacts. I mean, if you can still implement all of the things that you can do to keep your contacts minimal, you're going to have a better chance of not being called up from public health and saying, hey, you've been identified as a contact, So I think that for a lot of people is, it's a motivator for me, for sure. The logistics of isolating and in my home with children, and I mean, it's a lot. So I absolutely, from a personal perspective, like, I'm going to do everything I can still. We might be in phase 5. I don't know what the future holds, but I'm still going to be protecting myself as much as possible, because I know that there's still nothing, that there's still no other treatment for this except quarantine and isolation.
Yeah. Well, and we've been busy here at the studio, because I mean, we're doing this kind of stuff. Everybody is streaming, and we've had a couple of weeks ago, we had an election. When was that? I guess that was a week ago Tuesday. Yeah, we had an election night show, and as we're preparing for this show, one of the key individuals got sick. And for a minute it was like, wow, what an impact that have been. I mean, we don't have there's not very many of us that are hanging around each other, and but still, when I thought about that, I thought about, wow, what would have happened had he had COVID, and he actually was tested and went through that process, but how would that have impacted me personally? And that's a pretty big burden. And so it's kind of, I'm changing, I mean, when I wash my hands in the restroom, I'll hang on to the paper towel to open the door and then throw the paper towel away. I mean, there's just all these little things that you do that 6 months ago, you're like, oh, that's craziness, So here we are, right?
I'm glad to see you slowly coming around, Brent. I'm it's like every week we get this little,
Yeah.
little bit more of a glimpse at we'll win you over. And I appreciate your honesty, because I think you represent a majority of the public. And so I really appreciate you being candid with how this is a struggle for you, because you are our patient. You're a Union County resident. So, I mean, you are who we are working for.
Yeah. Well, thank you. I guess I need a sticker or something. Yeah. But I guess I find that people, it doesn't matter where people are or who they are or what their culture is. You know, if you can explain things to them in a way that makes sense, you can bring about change. You know, I think that sometimes people get off on a tangent and they think that the government's just trying to control me. And I'm sure that, you know, I'm sure if I got a call from public health and said, you have been identified, it'd be like, holy smokes, I feel like I'm in Germany and somebody, you know, I mean, it would be easy to get there and to go there. But when you think about the background of it all, and you think about, oh, okay, well, this just makes sense. You know, if I'm going to enjoy the relaxation of the isolation, then the other side of it is that there might be things that I have to do to, and that is the tool. You know, we're using different tools, but those tools still impact us in our lives, and you know, it's going to have some impact on us. So, all right, well, hey, ladies, thanks so much for taking the time. Good to be back together again, and we'll plan on being together again next Wednesday. LeGrand, I sure appreciate you guys commenting along the way and being able for us to have an interactive conversation. And I thank you, ladies, for jumping in with me today. So, and hey, thank you, EO Alive TV, and we'll see you. Hey, in fact, this weekend right here, we're going to have Saturday at 10 o'clock. We'll have the LeGrand High School graduation. So be sure and jump into that. Thanks. Good job, you guys.
I don't feel like I articulated what I wanted to about testing quite as well as I wanted, but it wasn't coming out for some reason.
Well, but this was kind of like the soft opening, right? This is like the, yeah.
It'd be really super cool if next Wednesday we can be like advertising some numbers and some times and some details. I hate being ambiguous, you know, people don't want us to come on here and be ambiguous with our answers. So it's hard, but we can't, you know, we're not going to promise anything we can't uphold either. So